Today at the ASCO annual meeting, Dr. Holmore presented the results of adding goserelin, a luteinizing hormone-releasing hormone analog, to cyclophosphamide-containing chemotherapy in women with early-stage hormone receptor-negative breast cancer. What was the rationale behind using a LHRH analog?
Well, earlier studies looking at suppressing ovarian function with LHRH analogs had demonstrated high rates of return of menstrual cycles for women receiving chemotherapy for various conditions. However, randomized trials have had fairly inconclusive findings, so this is something that we wanted to look at further.
How did you treat women with goserelin, and what were the main findings of the study?
Goserelin was given at a dose of 3.6 milligrams subcutaneously once every 4 weeks, and it was started about a week before the first chemotherapy dose and continued throughout the duration of the chemotherapy. The main findings of the study were that the women who were randomized to receive goserelin had a significantly lower rate of ovarian failure compared with those who received chemotherapy without the goserelin. In addition, we looked at pregnancy outcomes and found that women who received the goserelin were more likely to achieve a successful pregnancy. Finally, we found in looking at in an exploratory analysis at disease-free and overall survival that the goserelin appeared to have a favorable effect on disease outcomes in this group with ER-negative breast cancer.
How important are these findings for young breast cancer patients, and should these findings change the current practice?
I do think these findings should change practice immediately. Ovarian failure is an extremely important side effect for young women treated with curative intent chemotherapy, and particularly those who are interested in future fertility.
How should one interpret the finding that women treated with goserelin were 50% less likely to die 4 years after starting treatment when compared to those in the standard arm? And could you explain the biological mechanism behind this effect?
So the survival outcomes with the goserelin were really an exploratory analysis, and we wanted to assure that we weren't impairing the effects of the chemotherapy. We wanted to make sure it was safe to give the goserelin. We weren't really expecting this result of an improved survival and disease-free survival. There's a number of potential explanations for this, including the presence of LHRH receptors on many triple-negative breast cancers. There may be effects of estrogen preventing apoptosis, but this is really something that's going to need further exploration.
Are the results also relevant for women diagnosed with other types of cancers?
I think these results are relevant for women with both ER-positive breast cancer as well as ER-negative breast cancer and other types of cancers that are treated with similar chemotherapy, such as lymphoma.